Hi there, my name is Maya, and today I will be talking about bladder stones for my show, tell, and learn presentation. Bladder stones are a particular topic that I'm interested in just because my childhood dog actually had bladder stones at one point. It was actually just earlier this August, if I remember right, and it is kind of scary, so I kind of wanted to help everyone learn how to recognize symptoms and kind of what treatment entails. So to start off, I'm just going to go through some general information about bladder stones just to kind of set the stage before I get into Buddy's story in particular. So what are bladder stones? Bladder stones, or also called uroliths, are rock-like formations of minerals that develop in the urinary bladder. And this is according to VCA. I actually got a lot of the information in this presentation from this particular website. So it's very helpful, very useful. And then just some common types of bladder stones in dogs are struvite, calcium oxalate, urate, cysteine, xanthine. And then these little letter combos I have next to them are actually corresponding to Hill's prescription diet formulas. So these prescription diets can be prescribed to an animal by a veterinarian. And in this case, these formulas are made to dissolve or prevent certain types of stones from forming. And so Buddy, my dog, actually he was suspected to have struvite stones, so he was prescribed the CD formula, which is that bag on the left there. And then urate and cysteine stones, you would get UD. And xanthine, I'm not really sure if there is a food that can do all that. I couldn't find one, but I'm sure there's something out there. So how do they form in the bladder? Really, we don't know. There's only a theory, and that is the precipitation crystallization theory. And this theory states that one or more stone-forming crystalline compounds are always present in elevated levels, or they're always present in the urine, but in this case, they're elevated. And this could be due to dietary factors or previous diseases in the bladders, particularly a bacterial infection. And it could also be due to a problem with the body's metabolism. And now when the amount of this compound exceeds a threshold level, the urine will become saturated with it and cannot hold any more of that compound. So basically the excess compounds will precipitate out of solution, forming tiny crystals, and those crystals will irritate the bladder lining and cause an excess production of mucus. And so once those crystals and the mucus stick together, they form clusters that will gradually enlarge and harden into what we know as the bladder stones. Now, what are some of the symptoms? These are pretty much just the main symptoms that I found on that VCA website. So that would be blood in the urine, or hematuria, if you want to look at the Latin names. This is because the stones will rub against the wall of the bladder and cause irritation and bleeding. Then there's also straining to urinate, or dysuria. Basically, this inflammation and swelling of the bladder wall or the urethra. It can also have muscle spasms involved. Or it could be due to muscle spasms, and it could also be due to a physical obstruction of urine flow, which is actually what my dog had. So if the stone is obstructing urine flow, it becomes an emergency. If the obstruction is not relieved, the bladder could rupture, and this may be fatal. So this is kind of the big symptom to look for. Now, what are the treatment options? There is surgical removal, where the stones are removed via a cystotomy. So they will open up the bladder and physically remove each stone by hand. And then there's something called urohydropropulsion. So if the stones are small enough, it might be possible to pass a particular catheter into the bladder and then flush the stones out. This method works great. It helps you avoid surgery, but it's not always effective. And then dietary dissolution. So that's where the special diets come in, the UD, CD diets. So you can actually dissolve some stones. Now, this method usually takes a lot longer. It's not always effective. And the food can be pretty expensive, but of course, it would always be cheaper than surgery, most likely. So now that I've gone over some general information, I want to talk a little bit more about Buddy, my dog. So Buddy is super cute. He's been my best friend for 15 going on 16 years now, and you can see we kind of grew up together. Those top two pictures are us when we were little, And then that bottom right one is actually taken, I think, the day of or the day before he started showing UTI or bladder stone symptoms. So he is a neutered male. His weight is about 22.3 pounds last time we checked. And his breed is Bichon Frise Lhasa Apso mix. So he's very cute, very, very, very fluffy. And some historical medical issues. He does have a grade 6 heart murmur. It's usually grade 6. Sometimes it's grade 3 or 4, but it has been grade 6 in the past. And he does have some old man arthritis issues. You can kind of see in that picture, his front legs are a little curvy. He's got some elbow problems, but it certainly doesn't slow him down. But the important thing here is that he has no history of bladder or urinary tract related issues. So we've never had bladder stones in the past, never really had bacterial infections like UTIs, anything like that. So on August 15th, 2022, just this past August, that's when he started showing symptoms. So he was straining to urinate. So he was in this peeing position, but little to no urine coming out. You can kind of see this picture of this beagle here, kind of making a face, trying to pee, but can't. That actually looked a lot like Buddy at the time. And also he had a high frequency of attempted urination. So you could really tell he needed to go. Like his bladder was full, he just could not get anything out. So he was stopping on our walk every 10 seconds or so just to try to pee again and again. And then some restlessness. He wouldn't hold still, he wouldn't lay down, just very atypical for an old dog, particularly Buddy. He's very lazy. So right then and there, I knew something was wrong. I wasn't sure what exactly was wrong. So I went with my gut and I called my veterinarian. So as soon as we get to the veterinarian, we sedate him and we take an x-ray. This radiograph is of Buddy, is the actual one that we took. And you can actually see, hopefully you can see my cursor, but we've got a group of bladder stones right here in the center, 2 big ones here, and then 2 small ones right next to them. And then here you can see his penis and the baculum. And right here, big urinary stone right at the end there. And that was what was obstructing his ability to urinate, basically. So we definitely had some issues that we needed to take care of. And it was time to act. So our first step was dislodging that stone that was sort of blocking his ability to urinate and emptying his very full bladder. So like I said, we did sedate Buddy and we placed him in lateral recumbency. It was just me and my veterinarian in the office at like 10 p.m. So between the two of us, it wasn't terrible, but having him sedated definitely helped. He's not a huge fan of being at the vet. So next, I extruded his penis, sort of like how that picture is showing there. And then the doctor inserted a lubricated catheter tube. And in this case, the size really did matter because you want it to be comfortable for him. Obviously, you don't want a huge tube going in there, but it has to be big enough and strong enough to be able to dislodge that stone. And so once we found the right size, the tube pushed that stone back towards the bladder, and we were able to completely empty the bladder through the tube, and it took forever. We had a very, very full bladder. It was a lot. The pee was just everywhere. So then we went for a second radiograph here. And now you can see right in a nice little bundle there in the bladder is 6 stones total. We've got 4 big ones and those 2 small ones again. So at this point, we knew these were all of the stones. We took multiple radiographs, didn't see any other ones. And at this point, the thought was we take him home and we see what he does, see if the stones, get lodged again, that sort of thing. But of course, they did get lodged again because that is just our luck. And so the next morning, Buddy was straining to urinate again, and we knew that it was surgery time. So I called my veterinarian once again, and he's right there in that picture with me. And we opted for surgery. So the surgery is a cystotomy, like I mentioned earlier, which is just a surgical procedure to access and open the bladder. It involves a somewhat large abdominal incision. Can't really see it in the picture there, but it was pretty large, larger than I thought it would be. And then once we have access to the bladder, you can search for, find, and physically remove each of the stones. And having those radiographs is key because we know exactly how many stones we're looking for and how big or small they are. So for Buddy's surgery in particular, 6 stones total. We got that. His old age did make us nervous. I was there monitoring him under anesthesia the entire time. I had to breathe for him a lot. I had to, squeeze the bag and breathe for him several times. But other than that, everything was very steady. His monitor was good. We did have some trouble finding the stones. At one point, we had another veterinarian actually come in and kind of help Dr. Cody dig around a little bit, but eventually we did get all of them, and it was a success. So we found and removed all 6 stones. I was actually able to keep one of them as a sort of morbid souvenir, and I would have been able to show that in class, but unfortunately we ran out of time, so that's just too bad. So post-surgery, we took one last radiograph, and you can see here there are no stones in sight. He did a wonderful job. He was very brave. I didn't think he would be. And like I said, he did pretty well under anesthesia, other than, just having some breathing problems. But for an old man, he did a great job. So let's talk a little bit about recovery. So I got more pictures here. You got a nice drugged up face in that top left picture. And then that picture on the right side, that is actually his incision site, and it has some redness around it, just from irritation. And then there he is in his bed, kind of angrily sleeping and resting and trying to stay warm. That's what a lot of his recovery actually looked like, was him just in his bed, kind of angrily shivering and trying to sleep. But he did take a long time to come out of anesthesia. Lots of trembling and whining at first, which is pretty typical. Those meds can make the animals very cold, and so it's important to get that warmer on them right away, get some towels, blankets with them, and just kind of try to help them come up out of those drugs and be a little less scared. He was sent home with pain medication and antibiotics, of course, and on top of those, we did use some NSAIDs that we already had for his arthritis. And while he was recovering, he had very little control over his urination and defecation for a while. It did eventually get better, but all I can say is that we were just happy to see he could urinate successfully. That meant there were no stones obstructing anything, and he was all good. And after about 2 weeks, he was pretty much fully recovered. So now it came time for a recurrence prevention plan. So my veterinarian, again, recommended this urinary care CD formula from Hill's Prescription Diet. And if you've seen the bags in the past, they had this border collie on them, but now they actually have some kind of doodle, I assume. And they, like I said earlier, they have wet and dry food options. But the issue is it's not very palatable. Whether you use the wet or dry formulas, it just doesn't taste great. My dog hated it. So we were able to use this food for about 2 weeks post-surgery, but he just refused to eat it eventually. So now we're actually using Purina Pro Plan, Complete Essentials, adult dog food, and he loves it, and it's healthy. It's a well-balanced diet. It was recommended by the veterinarian, so we're happy with that. And then another method of preventing recurrence is hydration. So we didn't think that Buddy had any issues not drinking water, but he might. And so we encouraged him to drink more and more. We encouraged him to drink more and more water by making sure there's always fresh water around. And the doctor did emphasize that hydration is the key to preventing many different bladder and urinary tract issues, including stones in particular. So I wanted to detail a little bit more about the CD diet because I think it's really interesting, and kind of helps, see what the company's all about and see what this particular formula does. So you can see how it helps is it's formulated to dissolve struvite stones and lower recurrence risk, and lowers risk for formation and recurrence of calcium oxalate stones as well. And then also helps nourish and maintain a healthy bladder. So that's always good. And then how it works, I thought was really interesting. It's going to help lower that concentration of building blocks for bladder stones. I kind of talked about that earlier with the sort of theory about how stones form. And then controlled calcium, low sodium, and added potassium citrate are helpful ingredients, and then fortified with omega-3 fatty acids to support urinary health. So anytime a company gives these sort of scientific sheets, you probably should take them with a grain of salt, but when it comes time for something that a veterinarian truly recommends, I think these are always really interesting to read. So how can you prevent bladder stones? Now, it's important to emphasize that in general, it's kind of impossible to completely prevent bladder stones. They're pretty unpredictable, and you might feel like you do everything right and they still pop up. So the key to preventing an expensive surgery, in the very least, is early detection. Make sure you monitor for symptoms every time your dog urinates. Watch for that blood or straining, anything like that. And then also opt in for those yearly urinalysis tests along with blood work. That can kind of help keep track of their bladder health and make sure those, different nutrient levels are good in there. Feeding a urinary care diet may also prevent some types of bladder stones from forming, but no diet can prevent all types of stones. So even that's not really a guarantee. And then, like I mentioned a little bit ago, you should always allow your dog access to fresh, clean water. That will encourage them to drink, and it will keep them hydrated, which is very, 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 very important. But that's all I have. So thank you so much.